Joining us now is a leader in homeless and street medicine, Dr. Susan Partovi. She is the medical director for Homeless Healthcare Los Angeles. Good morning, doctor. I appreciate you joining us.
Thank you for having me. I really appreciate being on.
All right, so you've been called the renegade doctor of Skid Row because you're an advocate in revolutionary ways, and you call for the implementation of safe injection sites like those in New York City and other countries actually as well, and it's to combat the opioid epidemic. So why do you support a harm reduction approach? Tell folks about this.
Because that's what works. So if you want to be comfortable, don't go with harm reduction. You have to think out of the box, and you have to think what's going to work. And so if we want to save lives, and that's what my job is, you have to do what works, and harm reduction is what works. So if someone's coming to you and first of all, we're treating them like we would want to be treated ourselves. We're treating them like our own siblings. We're treating them like our own children. And we don't want these people to suffer, but we definitely don't want them to die. And so we're really just reaching out there, and we get that it feels uncomfortable, like even a doctor saying, supervised drug use centers, overdose centers. It does feel weird saying that, but the evidence shows that that's what saves lives. So if you look at New York, if you look at the Netherlands, their death rate is zero. It's zero. So, you choose what works.
It's right. Trying new different things. What's the definition of insanity? Doing the same thing over and hoping for different results. So you're trying to find new ways, and you're seeing that it's effective overseas. Tell us a little bit more about this healthcare center and the services that you all offer.
So one of the sites we have is the Center for Harm Reduction. And so people who are drug users can come, and there's a lot of different services that we offer. I think the main draw is the needle exchange, but we've definitely grown from that, where we offer medical services. That's where I come in. So, I've been with them since 2004 when we started seeing infections and wound issues. And so we started addressing that. And then when Narcan came out, we started distributing Narcan in 2004. When buprenorphine came out, we started a buprenorphine program as early as, I want to say, 2010. And most recently, we have pretty great antipsychotics that are long-acting injections, and we're using that for those with severe mental illness and psychotic behavior. And historically, the medical community wouldn't want to treat drug users for their mental health issues, and so you had this vicious circle. And we're doing both because that's what works. And we want to address with what the patient wants to be addressed. So we're working with them. So if we see that they're using fentanyl, which is more and more the case these days, sometimes I'm saying, can you switch back to heroin, just so you don't die. Yeah. We have one client who's been nailing Narcan kits on trees throughout Skid Row.
Doctor, I gotta stop you here. I appreciate you joining us so much. We're running out of time. You do so much for the community. I just want to say thank you, Dr. Susan Partovi. Again, thank you so much for joining us. We appreciate it.
Oh, thanks for having me. I really appreciate it.